Hi guys, I decided to make this video because some of you may or may not know, but I recently was diagnosed or recently was told by my doctor that I have beginning stages of cancer. It is thyroid cancer. If we were to get any cancer in our bodies and we had a choice, thyroid cancer would probably be the best choice because it has a very high survival rate. But anyways, any cancer sucks, and I'm just trying to deal with this the best that I can. So this video is mainly for awareness. I don't want anybody to feel pity on me. This is, like I said, for awareness. Hopefully I can help somebody in some type of way. So in this video, I'm going to be talking about the thyroid gland and the 3 most common thyroid conditions, and yeah, hopefully you guys can go get checked, or if you have thyroid disease, or if someone you know has thyroid disease or has these symptoms, please go to your doctor and please make them aware. Unfortunately, this is not something that is routine. You do have to specifically tell your doctor, oh, okay, I'm starting to feel these symptoms. Please, can you check my thyroid functions? So you have to communicate this to your doctor. It will not be routinely checked. I have been dealing with this for a long time. I actually have had all 3 thyroid diseases in my lifetime. I've had hyper, I've had hypo, and I have had a goiter in different times of my life. But it's something that you just learn to deal with. Now I am dealing with this whole new beginning stages of cancer, and I'll get more into that later. I will be making a more lengthier video regarding the more thyroid diseases, because there are more, and there are also other autoimmune diseases that go along with these thyroid diseases. But this video is meant to just be short and sweet and just to let you guys know a little bit about what's going on with me. So let's first tell you guys about the thyroid. The thyroid is a little gland. It is a butterfly-shaped gland, and it lies right down here in the lower area of your neck. It's right in front of your esophagus and your trachea, and the thyroid gland pretty much controls everything as far as digestion, metabolism, weight gain, weight loss, your mood, and your temperature. Even, you know, if you're fertile or infertile, it has a little bit to do with that as well. But anyways, so let's talk about hyperthyroidism first. So hyperthyroidism is the overproduction of the thyroid gland. The overproduction of the thyroid hormone that your thyroid gland is producing, which makes all these functions in your body move rapidly. So people with hyperthyroidism are very anxious. Sometimes they feel hot very often, more often than usual. They sweat excessively. Some may have really rapid bowel movements. Some may notice like an extreme weight loss, moodiness. There are so many other things that go along with hyperthyroidism. You can also develop a goiter when you have hyperthyroidism. But like I said, I'll get into all that in a little bit. Let's talk about hypothyroidism. Hypothyroidism is the underproduction. A way to remember is it's hypo, so it's with an O, it's for slow. Everything slows down. Your metabolism slows down, your digestion slows down, you start to gain weight, you don't sweat as much, you don't, like, your body secretions are much less, you can become very infertile, you start to notice dry skin, you start to notice dry hair, you can also have a lot of hair loss. With hyperthyroidism and with hypothyroidism, you can have a lot of hair loss. And also goiter, you can have a goiter when you have hypothyroidism. So like I said, if you have these symptoms, please go get checked, go to your doctor. Now goiter. Goiter is the enlargement of the actual gland. So in my case, I have goiter. I don't know if you could see it here. If I turn this way or if I turn this way, you might notice that it's a little bulge. Mainly mine is on my right side. It's bulging a little bit more than on my left. But anyways, and then goiter can be just the over growth of the tissue, or you can have little nodules or little cysts or little, even little tumors in there that are growing, and that's making your neck kind of like come out this way. So I have 3 nodules, and every year I would get checked. Like I said, I've been going through this since I was very young. I was 15 years old, and I started feeling symptoms, and throughout my lifespan, or lifetime, I have been dealing with, like I said, hyperthyroidism, hypothyroidism, and goiter. So anyways, I go to the doctor, and the doctor that you would see is an endocrinologist, and he or she does needle-guided biopsies, or needle-guided ultrasound biopsies. It is a needle that they have to stick down, you know, in there and kind of take samples of the cells of either the cyst or the little nodules or the tumors that you may have, and then those go to pathology, and then they check if they're malignant or if they're benign. Anyways, like I said, many years I've gotten these things done, and usually, it would always come back benign, meaning good. But 2 years ago, I stopped going to the endocrinologist, and I really didn't go get checked. And then I recently started feeling really sick. I started gaining weight. I gained like a whole, well, not a whole lot, but yeah, I've gained like about 15, 16 pounds in the past 5 months. That's a lot in that short amount of time. So right now I'm a little bit on the heavier side. I also noticed that like my voice was getting a little bit coarser, and I was having difficulty swallowing and sometimes even breathing at night. And that's what could happen when you have goiter and it's starting to become very large and uncomfortable. So all that was going on, and I knew something was up with me. So I went to the doctor, and sure enough, I got an ultrasound needle guided biopsy, and that came back malignant. So the good news is that it's in the beginning stages, and you have a high survival rate, and usually all you have to do is get surgery. In some cases, some people have to do radiation. In other cases, some people have to do chemo. In my case, they said, okay, we're just gonna go in and remove the right side of your thyroid, and then we'll see if during surgery, if something's wrong with the left, we're just gonna take the whole thing out. And if your lymph nodes are infected, we're just gonna take some of those out as well. And then hopefully everything will be gone. But then that will get tested, and I will do blood work, and my tissue again will be tested, and then they'll let me know if I do need radiation, which in my case is what is worst case scenario is radiation, and that's it. And hopefully all is well. So like I said, this video is just to make you guys aware and to maybe help someone if you have symptoms, or if you know someone, please advise them to go to their doctor. And I just need a huge favor from you guys. I just hope that you guys send me positive vibes, because my surgery is next week. And you know, you get a little nervous no matter what. And I need positive vibes. I need all my prayer warriors. Please pray for me. I will be going into surgery on Monday. And the next time you see me, you might see that I'm a little different. I might have a little scar over here, a little warrior scar. I hope chokers don't go out of style, because I will be wearing those a lot. Anyways, thank you guys for listening. Thank you guys for watching. I love you guys. Please pray for me. Please wish me luck. Thanks again. Bye.